Results of a comprehensive survey of more than 2,300 physician leaders found that 55% of the respondents think the Affordable Care Act has more good in it than bad. The survey was conducted by the American Association for Physician Leadership and the NAVIGANT Center for Healthcare Research and Policy Analysis. Peter Angood, president and CEO of the association, wasn't surprised that many physician leaders approve of the ACA.
The Affordable Care Act, as it evolved through the policy development phase, had a lot of good aspects to it that were all designed to really improve healthcare overall. Physicians as a breed, if you will, always want what's best for patients. And so as they've reviewed the ACA, I think they resonate with how the good aspects of the bill can improve care.
Paul Keckley, managing director of Navigant, agreed.
The ACA expanded coverage, and to many clinicians, the AMA early on said, if it does that, if it can pull that off, then it's worthwhile.
On other regulatory issues, 57% of survey respondents agreed or strongly agreed that accountable care organizations will be a permanent model for healthcare delivery in the coming years.
The notion that physicians will be held accountable for performance in managing cost and managing outcomes is a market-driven done deal. That trend is sticky.
The current focus on accountable care organizations is one element of how the spectrum of care can be delivered and to do it in terms of value-oriented care. So the ACOs are going to continue to drive innovation in terms of the delivery of care and the financial modeling of care.
The survey respondents were enthusiastic about an end to fee-for-service payments. 63% of the respondents disagreed or strongly disagreed that the elimination of fee-for-service incentives in favor of value-based payments will hurt the quality of care provided to patients.
Yeah, value-based care it's here to stay. You know, and value is a simple definition. It's quality over cost. Some people say quality over price, but basically the value portion gets back to what's better for patients, what's better for the overall health of individuals over the course of time, and ultimately what's better for the population.
We're tiptoeing in that direction. It's not something that the government will get to as fast as private insurers and employers. The employers are the ones to watch on this value question. They are fast adopters of a value-based purchasing model.
Angood says we must have better measures.
The difficulty we're in right now is it's still going to take some time for the measurement science to evolve, but there's all sorts of public reporting strategies going on, and so the reporting is occurring on immature science, and so there's the potential for misinterpretation of what that data really means.
And on the movement toward transparency for physicians' business deals, 58% of the survey respondents agreed or strongly agreed that transparency is a positive trend for the future.
Transparency is like quality. Everybody throws the term around and no one means the same. So the data says that consumers want all this information. And the data says that consumers are not changing their behavior when they have the information. So it's an irony.
Yet Angood says transparency is critical.
Transparency for me is pivotal in terms of how we move forward. But coupled with that, there needs to be the ongoing education, the context setting, and the clarification of what that transparency means, because we don't want misinterpretation to occur.
Those are just some of the findings of the survey. Watch for more survey results in the coming weeks. Also, for complete survey results, visit physicianleaders.org.